Hello, everybody, and welcome to episode 21 of season 6 of the Fat Doctor podcast. I am your host, Dr. Ashalami, fat person, fat doctor, author of No Way, Everything You've Been Told About Weight Loss is a Lie, founder of the No Way movement, noway.org, and um, podcast host, self-proclaimed host of podcast. Well, I am. I am the host of a podcast. It is a podcast, and I host it. So, yeah, that's me. Most of you already know me. Some of you are new, and that's great. Welcome. Today we are going to meet Suki. Um, she's another character that I created not too long ago to help people who are trying to navigate the system that is very much set up to deny adequate healthcare to fat people. So Suki is in her mid 40s, works in education. Sorry, Suki. Has two kids and approximately zero spare time. She's lovely. I want to give her a hug, even though she's not real. She's warm. She's very practical. She's not a complainer. She's the kind of person who just pushes through, who just gets on with it. Just keeps going. Um, in spite of the fact for the last 2 years she has been in genuine pain, hips and back, lower back, hips, um, every day. It's getting worse. Slowly but surely it's getting worse. She has internalized the message that this is just what happens when you're fat. That's what she's been told by pretty much everybody her whole entire life. So she's like, well, it's my fault. So I just got to put up with it. She has actually been to see her GP. Unlike Ren, who understandably was putting off the symptoms, actually, Suki pushed through and she made that appointment, went to see her GP on 3 separate occasions, and on each occasion, she received a weight loss lecture, and that's about it. You know, eat less, exercise more, make sure you move, blah, 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 but nothing much else. Recently, she noticed that a couple of other of her colleagues, other teachers in the school, had similar symptoms to her and got referred to physiotherapy. One got an X-ray, and Suki's thinking, well, no one's ever offered me that. What's going on here? I mean, she's a smart cookie. She knows what's going on here, but yeah, she doesn't want to be difficult, right? And this is the thing. People who are being told not to take up space. Because if you're fat, you're not supposed to take up any more space. You're already taking up enough space. Not to take up resources from people who actually need them. To be quiet. To be kind at all costs. To defer to people in authority. When that's the way you've been conditioned your whole life, you don't want to make waves, and you don't want to waste people. I don't want to waste the doctor's time. I don't want to waste the doctor's time, and so I don't want to be difficult. That's exactly what the healthcare system relies on. And I don't care whether you live in the UK where resources are stretched because that we have a nationalised health service. I don't care whether you live in a country where you have private healthcare, you have insurance. It doesn't matter. Resources are always stretched. When it comes to public services like this, when it comes to healthcare, the people at the top, the people in authority are going to be making the most amount of money. And the people actually providing the care are always going to be overworked and underpaid. I mean, doctors make a fair amount of money, but you know what I mean. In general, doctors, in fact, I say that doctors make the most amount of money for private healthcare. NHS salaries are not great and haven't gone up really in the last 20 years. Most doctors haven't really seen a pay rise in line with inflation, let alone anything else. I'm not complaining. I'm just saying your doctor is not minted just because they're a doctor. Private practice obviously is a different kettle of fish, but they are overworked and resources are stretched. And if nothing else, the biggest resource is time. GPs in the UK usually just have 10 minutes with each patient. Even specialists will have 15 minutes, half an hour if they're really lucky. That's not enough time to do the work they're supposed to do. So even if they have the physical resources, even if they've got the money, which is very unlikely, they don't have the time. So the system relies on the fact that you don't want to make waves, that you don't want to cause problems, that you don't want to be difficult, that you don't want to waste anyone's time. They are relying on that so that certain small groups of individuals, people at the top, the very top of the pyramid, can make as much money as possible with the least amount of output. They are trying to profit off your pain, whether it's a nationalized healthcare system or not. Somebody out there is profiting off your silence and your complicity in this kind of charade of, oh, I can't possibly bother the doctor. That is literally what the doctor is there for. But I don't want to waste their time. And doctors make you feel sometimes, don't you? They like, why are you here? You could totally have managed this at home. Why are you wasting my time? Even if they don't say it out loud, you know what they're thinking. And so it's just it's just a cycle that never ends. So Sugi's just been put up with it as she does, as she is known to do. But there's a moment where she's kids are playing and the youngest one's like, Mummy, play with us, and the older one's like, don't ask mum. Stop that. You know mum can't do that because of her back. Don't be silly. And Suki hears this and she thinks, shit, I can't even do the things that make me happy anymore. Like, let alone the fact that she's in education. So she already has the hardest job on the planet. She's tired. She's also under-resourced, underpaid, overworked. Like she's a fucking warrior. And she's raising her kids. She's doing her best and she's putting up with it and she's keeping silent. And as a result, she can't even do the things that she wants to do. One of these days, the kids are going to be too grown old and they're not going to want to play with her anymore. And she will have missed that opportunity. And she gets to a breaking point where she's like, it's not fair. This is not fair. Why is she being punished? Other people are getting support. Why is she being punished? Um, yeah. Let's talk about for a moment what is often missed in or overlooked often in fat patients. Last week we were talking about Ren, and I was saying that weight as a result of weight stigma, doctors often just make snap decisions. Oh, this is going to be weight related, and as a result, they don't consider the other things that could be going on. If you're going to immediately jump to blaming weight, and I'm not just talking about weight. Sometimes it could be like, oh, clearly you don't get enough exercise, and that would explain why you're short of breath. Or clearly you eat too much and need to be more active. That will explain why you're so tired all the time. Clearly you're depressed because of the way you look. Like people, it's not just um your weight, but it's everything that people assume about you because of your weight. All of those assumptions and judgments and stereotypes. So there are lots of common conditions that are commonly overlooked in fat patients, especially fat patients who have other marginalized identities as well. Joint pain, a pain, obviously it could be something like, your joints. That's often assumed, oh, you're fat. It's almost certainly arthritis. Who says? So I'm fat doesn't mean I've got arthritis. Thin people get arthritis. Fat people don't get arthritis. Doctors are less likely to consider inflammatory arthritis though. So they'll blame you're fat, so too much weight on your hips. That'll explain it. Just lose some weight and then you won't have this problem. But they won't actually consider other causes of actual joint issues. So it could be the cartilage, it could be the tendons, the ligaments, it could be an inflammatory condition. It could be an inflammatory arthritis. It could be psoriatic arthritis. It could be rheumatoid arthritis. Do you know what I'm talking about? Like, so there are lots of kind of conditions that doctors will sort of rule out without actually ruling them out through a blood test or an X-ray or whatever. Um, there's plenty of evidence that doctors will under investigate. So they don't look at bloods or order bloods or X-rays or imaging or whatever in fat people compared to thin people. So we already know this. Less likely to examine a fat patient than a thin patient, which again sucks because how can a doctor do their job if you go in complaining of back pain? How on earth is a doctor going to make a diagnosis if they don't actually examine your back? The amount of people that tell me, I saw my doctor and I go, what did they find in the examination? And they look at me like, what examination? I'm sorry, you went to see your doctor with a painful hip or a painful back and they didn't touch your hip or your back. Yep. Mind blown every time I'm told this. I know this is a frequent issue, but I just can't imagine trying to do my job and actually not, I was going to say touching a patient, but that sounds wrong. But not examining a patient. Come on now. That's not okay. There are other conditions that are much less likely to be diagnosed by clinicians, and that's because we know a lot less about them, and that's because we don't consider them to be important enough. Uh, Fibromyalgia is a really common one. Hypermobile EDS is one that often gets missed. Um, I'm trying to run through in my head in the moment all the different causes of joint pain. Hormonal stuff, perimenopause, a really common cause of joint pain. So Suki, poor Suki. If Suki came to see me, I'd be thinking set of bloods. Depending on, we wouldn't necessarily have to do a hormone profile because we can diagnose perimenopause without bloods, but I'd definitely do a set of bloods, and I would include inflammatory markers, and I would include thyroid and B12 and probably vitamin D. Controversial. I'd try to rule out rheumatoid arthritis. It's unlikely with back and hip pain, but it's possible. Of course, I would have to take a thorough history and do an examination as well. Um, if she's had hip pain for a long time, I'd probably send her for an X-ray of a hip. I wouldn't send her for an X-ray of a back, but that's because we don't X-ray backs. But hips definitely seems like a reasonable thing to do. And I would do all of that first and then get her to come back. And I would then consider other conditions that could be causing it. And if it's not something that I feel that I can easily diagnose, like I'm not sure what it is, like it might be fibromyalgia, it might be perimenopause. I might say, hey, do you want to try uh, a trial of treatment? Is there something that we can do here and now? But if I feel like actually this isn't something that I can manage here in general practice, I would refer her to a specialist. And there's a very good chance that the specialist would go, fuck off, I'm not interested. She'd probably end up in the musculoskeletal clinic being seen by a physiotherapist. Physiotherapists tend to be quite good, to be honest. They're better than doctors anyway. But they will have like triage protocols, and with backs, it's almost certainly going to be weight loss lecture, maybe some physio, bunch of exercises, off you go, and that's the end of it. Uh, that is the reality, isn't it, of our failing medical system. So what do you do then? What do you do when all of that fails? The thing is, most fat people don't even get that far. Like I said, Suki's thin colleagues, the thin teachers in her school, get referred to physio straight away. The fat teachers get told lose some weight first. So more often than not, they're not even getting the blood test, not getting the examination, the blood test, the x-rays, etc. So they don't even get past that point. And that is a real problem. But even if you do get past that point, you're still not always going to get the care that you need because you're going to face the weight stigma every step of the way. If you do get referred, if you do get an x-ray or imaging, there's going to be a big thing right at the top of the report. Interpretation difficult because of body habitus, which is literally the first thing that any radiologist writes now is this patient is fat, therefore I can't make any can't draw any conclusions. Man, learn how to interpret images better, my friend. Like, stop blaming fat people for the fact that, I don't know, you can't do it. Like, that's not true. It's perfectly possible. You just have to learn the skill. Sometimes it's difficult because of the actual image. It was taken at the wrong angle or whatever. Like, I'm not saying it's always possible, but this is just weak source. I mean, you literally do it with every patient now. That is the standard thing. I'm sure they just copy and paste it from from a document. They don't even write it out every time. Fat patient will just put that as a pro forma, a standard thing. This is the standard report for fat patients. The first thing it says is, interpretation was difficult because of body habitus. Dicks. Anyway, you face weight stigma when you go to get an MRI because they don't make them your size. They don't accommodate people your size is what I'm going to say. Like the knee one, especially because you have to put your knee in this like bracket type thing. And I can't remember who told me this, but it was something like 1 in 5 people get sent away because their knee doesn't fit inside it because this stupid contraption is too small. MRI machines have weight limits. So what do you do then? If you don't fit in the machine? Gowns, fucking gowns that fit. Nobody wants to walk through a hospital down a corridor with their ass hanging out because they were given a gown that clearly is too small for them. Just have larger gowns in your waiting room. Anyway, I digress. Um, so you're going to experience weight stigma every step of the way. You finally go and see a specialist. Again, you have to go through the whole thing again because they're going to blame your weight. You go and see a physiotherapist. They're going to blame your weight. You go and see a specialist. They're going to blame your weight. And even if you get to the end and somebody actually makes a diagnosis, they're still not going to treat you because of your weight. So you face weight stigma every step of the way. Weight stigma is a clinical shortcut, my friends. It is a clinical shortcut. It allows doctors to do less work. If they can blame your weight and just tell you to fuck off and lose some weight, come back once you've lost some weight, that just made their lives a whole lot easier. It is a clinical shortcut. And again, it's not just the individual doctor. This is the system that's created an environment in which this has become normalized and has become the clinical shortcut, and in many ways, a way to make money or to save money, to make money and or to save money. It's not rudeness, and we're not talking about, oh, my feelings are getting hurt here. This is not what we're talking about. This is serious. It is a systemic failure with very real consequences. We don't know why Suki has back pain. It's unlikely, but Suki could have myeloma, right? And you're not going to know that unless you do a blood test, at the very least. I remember on multiple occasions throughout my career having a patient who's come to see me and me thinking, oh, it's probably going to be a ligament or something, and been quite shocked and devastated by, a cancer that gets picked up or a really serious diagnosis that I did not see coming. And that had taught me, over the course of my 20 years of seeing patients, it taught me like never assume. And I don't assume it's going to be it's better to be safe than to be sorry. That is my attitude to practicing medicine, but it doesn't seem to be my colleagues' attitudes for some reason. I don't know, some of them are more like, more cowboys and just willing to take the risk. Um, so what do you do in this situation if you're Suki? How do you handle this situation? Again, I'm going to say the same thing that I said last week. If you know what you're entitled to, if you know what to expect, then you're already halfway there. Like, for example, you should be examined, especially if it's something that you can examine. Like, there's some things that you can't examine. It's difficult to examine anything that's going on in the head, although a neurological examination should be standard care. But if you've got like pain, if you go to see a doctor for the first time about pain and they don't examine you, you have every right to go, sorry, aren't you going to examine me? Or when are you going to examine me? Slightly more polite way of saying it, isn't it? When are you going to examine me? It's a very legitimate question because they should be. You can also say, when are you going to organise tests? Like, okay, you're not going to organise tests this time, but at what point in time will you organise tests? You can say, how are you going to rule out, if there's something that you're worried about, how are you going to rule out such and such? And this is where it gets really problematic because what fat patients have learned to do is they have learned to become experts because they have to do all of the reading and the researching and the learning about their medical condition beforehand so that they can get a doctor to take them seriously. And sometimes they'll print shit out and like they come prepared, ready to do battle because they know that they're going to be dismissed otherwise. This is so unfair. This puts an unnecessary burden on fat people who are already burdened by the healthcare profession. And I'm talking to the doctors out there, your patients should not have to tell you how to do your job. All right, you should know that you're supposed to examine the patient. You should know what bloods to order. You should know what X-rays you should be requesting. You went to medical school. You. There is a reason that you have a degree and are in the job that you're in. And if you don't want to do it, find another job. It's that simple. If you don't like having to do it, then now is the time to quit. Now is the time to take a sabbatical, if nothing else. You've burned out. I get it. I understand. If you've burned out, then you need to walk away. Step away, because you're harming people by staying in the position that you're in. So that's to doctors. But if you're a patient, it's about knowing what you're entitled to. A full history, an examination, investigations. It's about, asking questions like, what could be causing my symptoms? Can you give me a list of all the different things that could be causing it? Do we you need to be ruling out right now? What are some of the serious, potential serious diagnoses that we don't want to miss? And you can use collaborative language like we don't want to miss, we're in it together here, pal. Like I'm here, you're here. I want to support you, you want to support me. Let's work as a team. You can play around with the language, but essentially what you're saying is, hey, you're supposed to do your job. I shouldn't have to be your keeper, but I will be if you refuse to do what you're supposed to do in the first place. So ask directly, what could be causing this? What do you need to rule out? What are the serious things you need to rule out? How are you ruling them out? What tests do you need to do? Uh, some people say, oh, ask the doctor, what would you do if I was a thin patient? You can absolutely do that. I think that is going to result in defensiveness that perhaps isn't necessary. You don't have to bring your weight into it. You will absolutely have to bring your weight into it if they're talking about your weight. So you might have to say, all right, other than weight loss, what else? You know, dismiss that, put that to one side. Like, I've heard you about the weight loss. Thank you very much. But what else? What else could be causing my symptoms? What else do we need to look for? What else do we need to rule out? But if they've not brought up your weight, then you don't need to bring up your weight either. You don't have to sort of throw that in there. You can just keep pushing back gently, asking quite directly about what you want and what you need. And then if they're not doing it in the first time, make sure you leave there with some kind of follow-up. Okay, fine. You want me to try losing weight. So when do you want to see me back? What happens if I can't lose the weight? What happens if I don't want to lose the weight? Like, when are you next going to see me? When will you order the test? At what point in time should I be concerned? Like, gently push back, escalate it. And if none of that works, then you have to make the second appointment and maybe you need to see a different specialist. Maybe you need to ask for a second opinion. And that gets really complicated. I don't want to get into all of that there today. But as I said last week, there is a script that's available for you that has a set of questions that you can ask when you need to escalate things. I want to imagine now Suki goes to see the doctor, right? She's been fobbed up 3 times, fourth time's a charm. She goes in there and she's prepared this time. So I'm gonna be Suki. All right. I'm gonna give you an idea, bit of role play. This is what I would say if I was her. I would say, and oh my gosh, I probably should have planned this in advance because this is completely improvised now. This is a free for all. There's no script here. I'm just doing it. Let me just get into character. Mm. All right, here we go. Hiya. I'm here to talk to you about my back pain and my hip pain, which, as you know, I've had for quite some time. I've been here a few times before about it. It's not getting any better. It's actually getting worse. And I'm at the point now where we need to do something else. I can't put up with it any longer. It's impacting my ability to do my job. It's impacting my ability to look after my children. It's really bringing me down. I know that you haven't examined me yet, and you haven't or the doctor hasn't examined me yet, and not ordered any blood tests or any X-rays or anything. But I really think we've got to the point where we need to do something a bit more. So I've just come in today to figure out what's going on and what are my next steps, something like that. I would, if Suki, I might talk a little bit about the pain. It's been going on for 18 months. It's been getting worse. It starts in the middle of my back and spreads to my hips. I might give some information, but not too much information. This is the key. You don't want to overwhelm. You want to give a little bit. If the doctor says anything about my weight, I'd be like, look, we've talked about weight in the other 3 consultations. I really don't want to talk about it again today. It's not necessary. I'm not planning to do anything about my weights. Thanks very much. Let's move on. I might not say it like that, but that's what I do. Look, no, just going to stop you there. I don't want to talk about my weight at all today. Can we just not talk about it? And a doctor might say, okay. They might be shocked and go, oh, okay. Or they might go, well, why not? And I'll say, because I don't want to. And I think that's a good enough explanation. I just don't want to. No is a complete sentence. You don't need to explain why. You don't have to defend your decision. And if a doctor has the audacity to say, unless you're willing to talk about your weight, I'm not willing to treat you, or I'm not willing to take this any further, at that point in time, you give up, don't try it. This doctor is a waste of your time. You just say, okay, I'd like you to document in your notes that you're refusing to investigate. You're refusing to examine me, to even take a history, to examine me, to order any investigations, or to treat me because I refuse to talk about my weight. I just want you to document that in my notes, and I will see another doctor. And and I'll be putting in a complaint. You might not have to say those last bits, but yeah. All right, hope that was helpful. Um, Hopefully, in that situation, at the very least, the doctor will examine her. At the very least, we'll organise some tests of some kind, if nothing else, to get her out the door. Um, but another thing that Suki could have done in that situation is brought an advocate with her. In an ideal world, a thin one, a thin man would be best. If you have one of those lying around, they're the ones to bring with you. If you don't have a thin man, a thin woman will second best. If you don't have any thin people, bring a mouthy fat person, one who looks like they're going to butt in at any moment and who is prepped ideally with some kind of folder or piece of paper in front of them that looks serious, maybe some glasses if you're kind of going with props, because the role of the advocate is to advocate, obviously, but also to feel a bit threatening. Like the power dynamics change when there are two people in the room, especially if one looks like they're just waiting for a moment to jump in and say something. So an advocate would help too. And hey, by the way, if you're not getting anywhere, if you're really struggling, I consult with people. If you're looking for a doctor who cares, I'm a doctor who cares. You could book a consultation with me. That's an option. Um, a lot of stuff is in the book. No way, everything you've been told about weight loss is a lie. It is available now, both in paperback and Kindle version. Yes, I'm going to keep talking about it every single day. You hear from me? Yes, you're going to be sick and tired of me mentioning the name of this book, but it took me a really long time. It's kind of like when you have a baby. It takes you 9 months to fully cook that baby. So once you've pushed it out, you want to talk about it often. Show people pictures about it. Be like, see, look at this baby. Because if nothing else, it took a lot of hard work. So yeah, I am going to be talking about my baby, which is my book. And I'm not apologizing. I'm just telling you. I'm just setting expectations. Thank you very much for joining me today. I hope it was helpful. We'll be back next week with another person, with another problem, and hopefully with some more solutions. Thank you very much and take care. Bye bye.